Hey folks, this is Dr. Jeff Williams with Creekstone Integrated Care right here in beautiful Amarillo, Texas, coming to you again this week with yet another video that you can watch either on Facebook or on our Creekstone Integrated Care YouTube channel. This week we cover the topic of what does a chiropractic adjustment really do? How does getting your back popped at your chiropractor's office, how does that help you? Now, this is a question that can get different answers depending on which kind of chiropractor you ask the question of. This is a question that can really shine a pretty intense and bright spotlight on a deep divide in the chiropractic profession. For that reason, it makes sense that we address the division first before we get into the specifics of how a visit to a chiropractor near you is helpful. Now, when we boil it down, there are basically about three different sections or sects of the chiropractic profession. And here's what they are. The first one is a subluxation-based practice model. It's important that I explain this model and discuss it because many in the general public have a perception that all chiropractors practice in this model. But the truth is, this model actually, the subluxation-based model, actually makes up the smallest percentage of chiropractors that are currently practicing. The subluxation-based chiropractors, they typically adhere to the principles that were put forth from the very beginnings of the chiropractic profession, well over 100 years ago. The premise here is that if a person goes to a chiropractor repeatedly throughout their lives and stays adjusted, well, the nervous system will have no obstacles, or subluxations is what they call it, the obstacles. There will be no obstacles or subluxations standing in the way. So as a result of a clear path, the nervous system will better express itself through the spinal cord out to the organs and limbs, thus allowing the body to function better overall. This group often advocates not vaccinating your children, no surgery, and no medication, because if you're staying adjusted regularly throughout your life, well, then a person should be immune to disease, pain, or dysfunction of any kind, really. As a result, in this type of practice model, patients typically get very long-term and fairly expensive treatment plan recommendations. Now, I think most people would agree that this is a holistic and vitalistic way of looking at the body and health in general. Now, let's talk about evidence-based, practice-centered chiropractors. I think it's going to be pretty obvious quickly, so I'm going to go ahead and admit my bias here. I'm going to just upfront confirm to you that the evidence-based, patient-centered model is my way of practicing. Now, we know that professions have a beginning point, but then research improves and the knowledge base expands. As a result, our practice models and our treatment modalities and how we go about seeing patients every day, well, that's going to in turn change over time in accordance with what newer and more current research suggests is the most effective way to treat our patients. Makes sense to me. To put it in more relatable terms, where would we be if the medical field didn't learn and adapt and refresh their treatment models over the years based on newer and current research as it came out? Of course, the medical field most definitely has its issues, and we can argue that all day. But I think that we can mostly agree that we'd still be using leeches and probably going through bloodletting and things of that nature if they hadn't expanded their knowledge base through research and updated their ways of treating patients. Now, fortunately, the medical field is far beyond that, and much in the same way, the chiropractic profession, along with things like biomechanics, exercise, rehabilitation techniques, chronic pain management, and so many more things, chiropractic, along with those things, has really expanded and improved over the last 100 and 120 years as well. The patient-centered part of the model, of evidence-based, patient-centered, the patient-centered part of the model refers to the fact that a healthcare clinic should never make recommendations to their patients based on finances or based on what is best for the clinic and the clinic's numbers or statistics. When an office is more concerned with their numbers and finances rather than the patient sitting right in front of them, well, we refer to that practice as a doctor-centered practice, putting the clinic and the doctor's needs first. That's a doctor-centered practice. Patient-centered clinics, quite honestly, don't make as much money in general as a doctor-centered practice would, because they're not financially driven, right? But the concern for the patient, the honesty and the ethics, and I would even say love for your patients, those things are there in multitudes in a patient-centered practice. Now, this type of doctor is continually reading and reviewing the most current research in a constant hunt for the safest, most effective ways to help their patients get out of pain in the quickest and most cost-effective way. Not only that, but as one of our primary goals here, a patient-centered practice should be interested in teaching the patient to self-manage at home so that treatment recommendations are typically short and the patient is not led to feel like they are dependent on any particular healthcare practitioner, and certainly not in the long term. Now, the evidence-based practice-centered model is most definitely our model of practice here at Creekstone Integrated Care. So let's talk about agnostics real quick. Agnostic chiropractors don't really buy into the subluxation theory, but they don't really care about the research either. They're just kind of somewhere in the middle. And they know that chiropractic treatment works because they see it every day. But they don't really care why or how it works. They're not involved in that, and they don't want to be. And they're happy to just keep on trucking through their days without much concern one way or the other. While still effective, agnostics are a bit detached and unaware and don't typically engage in continually educating themselves, and they tend to be uninterested in updating their knowledge base on any regular basis. It's kind of like, I went to all that school, I got educated, and they got a heck of an education, by the way, I'll tell you that. But then they were just kind of done learning, if that makes sense. They just wanted ready to get to work. Now, the reason I broke this professional division down for you is that the question of how an adjustment works and how it helps is going to be answered differently by each sect. The subluxation-based explanation would be that an adjustment reduces any interference on the exiting nerves at the spinal cord level. And when there is a reduction of pressure or interference of the nerve or nerves, it's going to function better. And whatever the nerve runs to will in turn ultimately function better. For example, if the nerve, their theory goes that if the nerve runs to the stomach and you remove all interference to that nerve, then the theory is that the digestion will improve, okay? If the nerves, say, help the immune system function better, their theory says that if you remove all interference of all the nerves, then your immune system will function better and improve to the point that you're immune to any diseases. There have even been claims during this pandemic that getting adjusted regularly will help patients fight COVID. Many in this group, subluxation-based group, advocate getting adjusted regularly instead of getting vaccinated to protect against things such as the measles or the flu or any other malady that one would typically get vaccinated for. Now again, I need to be clear here. From my knowledge and my research, which has been fairly extensive, there is no reputable research that backs this sort of theory or notion up. So, just so you know that. Now, the agnostics will likely echo some of the previous explanations that I just gave you based on the subluxation model, and mix that in with some discussion about improving movement or segmental dysfunction. And the truth is, if a doctor's not aware of the research on the matter, well, they may not have an excellent description of what really happens. They just know it works. And you know what? They're not wrong. It works very well, whether or not they can describe the exact mechanism or not. I don't have to know exactly how a TV works to be able to turn it on and enjoy the results, right? So here's the real answer, according to me and other evidence-based practitioners. The evidence-based practitioners that are current on the research typically have a very robust, a very accurate description based on what the research is suggesting. So please forgive the brief spot of medical terminology here, but according to Dr. Malik Schlossberg in his article for the Dynamic Chiropractic on July 29th of 2010, he said, quote, "A joint that is injured, inflamed, degenerated, restricted in motion, or painful results in reflex inhibition, delayed activation of the muscles around it, and progressive atrophy of the multifidus muscle, which connects vertebrae together, innervated by that segment." By clinical examination, the chiropractor identifies such a movement disorder and then applies a high velocity, low amplitude thrust to the joint, which is a fancy way of saying a chiropractic adjustment. The high velocity force rapidly stretches the segmental ligaments, the joint capsules, and the intertransversarii and interspinalis muscles, which surround the vertebra and hold it tight together. It stretches the intervertebral disc and it intensely stimulates the numerous stretch receptors that are built into the muscles. This results in ligamental muscular reflex activation of the multifidus, again, muscles that surround the vertebral column, which attempts to stabilize the joint and protect it from possible injury as a result of the high velocity stretch or the adjustment. The segmental multifidus, which has been reflexively inhibited and is atrophying, is stimulated to contract. The stretch, the adjustment does that. This may reverse the reflex inhibition, progressive atrophy, and delayed muscle response documented to occur in the segmental multifidus, which overlies a dysfunctional joint, and restore dynamic function and contractility to this primary joint stabilizer. Now, that's a lot of terminology, right? I appreciate you letting me do that real quick. Most lay people, you're not going to understand or even care about that stuff, and that's okay. I want you to know that there's a technical explanation, but let me bring it into more current and relatable terms for you, okay? The adjustment activates a cascade of neurophysiological changes. I know you don't think I'm getting any better, but it will. That mostly these neurophysiological changes mostly work together in order to decrease pain and inflammation while simultaneously improving tissue recovery and area neurological mechanisms. Even more relatable and understanding is this concept. In order for your back, or any joint for that matter, to function correctly and without pain, it needs two things. It needs mobility and it needs stability. Simply put, it needs WD-40, mobility, and it needs duct tape, stability. Adjustments, like chiropractors are known for, increase mobility. That's the WD-40. Now remember, whether it's getting adjusted or whether it's exercising, motion is the lotion for the joints. Whether getting adjusted or exercising, motion is the lotion. Movement is healing. Think about it. When somebody gets a C-section or a gallbladder or their appendix out, the hospital has them up walking the halls the very next day. It sounds like torture, but it's true. Movement and motion are healing from a global scale, such as walking down the hallway, all the way down to a more focused level, much like individual segments of the spine and a chiropractor getting things moving. Now, the second half of this is the exercises that we prescribe each and every new patient. Those go to increase the stability. That's the duct tape. Now, depending on the condition, if a clinic only performs an adjustment and sends a patient on their way with no exercises and no recommendations for at-home exercise management, well, the patient, they could be getting better, more updated, more effective treatment recommendations. If, on the other hand, a patient goes to, say, a physical therapist and only gets exercises without ensuring proper movement in the areas of concern, such as chiropractors do, spinal manipulative therapy, the patient could be getting more effective and robust treatment, more current thought process there. It is the combination of movement and stability that is the secret sauce. Well, those two things plus consistency We must have a patient that is a partner in their own recovery. And this means they need to make their visits regularly for at least a couple of weeks before we know how effective we've even been. We can't get a good idea as to whether we need to change the treatment if we're not given the chance to go down the path a short way to see how the patient progresses in the first place. Now, when it comes to chiropractic treatment or adjustments, there truly is no other treatment out there that is as safe, as cost-effective, and as effective for spinal pain, joint pain, and headaches and migraines. Nothing as effective as spinal manipulative therapy. In short, a chiropractic adjustment does this. It acts as an analgesic, much like ibuprofen or Tylenol, and even very common prescription pain meds like diclofenac. They did a head-to-head research paper comparing diclofenac to spinal manipulative therapy, and there was no difference in the effectiveness. That's pretty amazing. An adjustment decreases venous stasis at the segmental level, giving more room to the other structures in the area. A chiropractic adjustment increases the descending pain inhibitory complex. And what that means is an adjustment bolsters the mechanism that decides whether pain triggers are going to be allowed up into the brain for processing. And as that little mechanism gets bolstered, it tends to allow less pain information into the brain. It squashes it down and says, we're not going to let that up there. So we tend to hurt less. And an adjustment also helps increase proprioceptive information. We have a little map in our brain of each and every joint in the body, how that joint should move and to what extent it can move. Now, chronic pain causes this map in our brain to get a little bit smudged rather than being crystal clear. Now, by stretching the little motion detectors in the muscles of the spine, the proprioceptive information concerning that joint and its movement is relayed to the brain, and eventually the map can begin to clear up due to what we call neuroplasticity. That means your brain can change and adapt and understand new things. So the map can clear up, and this allows for healthier movement of the joints since the brain is more clear on how to move it the correct way. Now, hopefully I didn't get too far off into the weeds and too far above the heads of this video viewer. The main point is that a chiropractic adjustment is much more than a simple back pop. Hey doc, can you pop my back? It's a little more than that, right? There are intent and purpose to it, and the research literature is so clear. It is extremely effective for those suffering from spinal pain, joint pain, and or headache migraine. And chiropractic has been shown as effective as many opioids like we talked about, more effective than any traditional medical treatment, and much less expensive. Not only that, but surveys consistently show patients have more happiness and patient satisfaction with chiropractors than they do with a physical therapist or a general medical practitioner. And this goes for all three sects of chiropractors. Even if a chiropractor is subluxation-based, at the end of the day, they're moving the joints, and that's effective. As are agnostic chiropractors, as well as the evidence-based chiropractors. Regardless of one's reasoning as to why they're utilizing it, spinal manipulative therapy or a chiropractic adjustment is still the overall cornerstone of the chiropractic profession. Now, I know I took the long way to get to how an adjustment works and how it's effective, but the meandering had its purpose. Visiting an evidence-based, patient-centered chiropractor can get you back on the path to safely, non-pharmacologically, and non-invasively with less cost than your other options in the healthcare market. And chiropractic should always be the first option for non-complicated neuromusculoskeletal conditions. So, my question to you is, what are you waiting for? Again, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in beautiful Amarillo, Texas. I hope my weekly videos here on Facebook and on our YouTube channel, I hope they're helping you. If we can help you here in our office though, our website is creekstonecare.com and our number is 806-355-3000. So give us a call. Let us get you in, get you to feeling better and back to being more involved in your life and in your family's life. Until next week, stay safe, and we'll see you then.